All right, it is 6 o'clock, so I'm calling this meeting to order, hoping this will be a shorter one because we're between, not between, but we just had a couple of meetings. So we'll give the floor to Trish with an update on the calls that she attended. Trish?
Okay, so I have 3 calls to report on. So starting with yesterday, there is an issue of the positive patient list that's being sent to the communities that signed the MOU, which is the confidentiality agreement. And again, as you've heard me say in the past, do you want to see who those are, Diane? You want me to stop?
Just Terry, sorry.
Just give me a minute.
Yep.
Terry Caswell, and who else?
Tina.
Okay.
Okay. And as they can, thank you, Diane. As they continue to remind us, there is a difference between the maps and the list. They're saying about 10% of the folks on the list are later scrubbed, and they're scrubbed for one of the following reasons. It might have been a bad address. They said maybe some gave no address, or in some cases, the testing site address was actually used. They asked a question about what is a completed case. And the answer from the public health was this means that they've been followed up with the public health and they're eligible to come off the list. There were also numerous complaints. Now this, by the way, was the legal call yesterday. There were numerous complaints from citizens that their names or addresses have actually been talked about in public places or on public meetings. And they reminded us this should not be talked about and that communities are not authorized to use information on the list for any other reason other than official use. So in our case, the police and the fire have access to that list, and they know how they're supposed to use it, and it can't be used to, kind of broadcast or talk about, hey, this house has a positive or whatever. It's just for official use for first responders. There were questions about will guidelines be sent out regarding enforcement? And the enforcement policy was posted on the web EOC. Chief Jewett can probably correct me if I'm wrong, but I want to say it was somewhere around the 23rd. He was on the legal call, and he's completely aware of what the enforcement law is. There was also questions about people asking about auto inspection rules. Should they be relaxed? Because we're asking people to go out to a public place or a town hall, and yet that conflicts with the governor's stay-at-home rule. So they asked about extending deadlines. They'll get clarification on this, but many towns are saying what Mary Jo says. The town hall is closed, do stuff online. There was also clarification on Order 25, wanting to know if it's incorrect that some towns may be collecting tax interest or on foreclosures and others are not. And the Municipal Association was on the call, and they've communicated with DRA, and they actually do want clarification. And they're going to tell communities, what they said was tell the communities to wait and see and get this clarification back from DRA. There was another talk about Order 27, again regarding campgrounds, and they are not covered under that particular order. And as we've heard in the past, if the campground was open before this started, they can stay open. If they were not open when this started, they cannot open now. And then one of today's calls was Concord DMV ended up closing today for enhanced cleaning. A staff member did test positive. However, they said this person did not have contact with the public. They said there were 747 cases, COVID cases in New Hampshire, 211 recovered, 13 deaths, 523 current cases, 108 were hospitalized, 8,389 cases were negative, which I think is so cool, and 4,312 were submitted to public health lab, and 89 tests pending. They're also talking about PPEs again, dangerously low, but there are 60 orders that are going out. They did inform us there are no more gowns left, so they're looking for those. So at today's call, different from yesterday's call, they mentioned there were 14 first responders that tested positive COVID-19. 136 of those first responders are quarantined, and 3 first responders are in alternative lodging. They did develop sample drop-off procedures with Public Health Lab to allow the public to transport a member's sample, up for analysis instead of waiting. And I think we've talked about that in the past, instead of waiting for the courier, because they're just getting far behind. They also released guidelines to include risk levels, depending on what your piece of PPE was or was not worn. So now they're looking at, to break that down, what's the risk level? Did the first responder have mask and gloves and no gown? Did they have a gown? Did they have a suit? What did they wear? And that risk level is going to dictate what they say your protection was or was not. They also reminded us that we don't have a disaster code yet, but until we get one, we'll continue to use the old code, and this is on all our EOC documents that Larry and I are doing, and it's COVID-19, and that's why we shared that with everyone, to make sure you write that on everything. There was talk about media trends. Obviously, there's steady conversations about COVID-19. It's very frequent. The topics that they're hearing on that social media on support and worry for the state and health workers for their safety, and they get that. Positivity around home hike challenge. They're saying instead of using trail systems, try to promote, being around your house. You'll notice that Diane and Larry and I and Conservation have uploaded the new poster, which I think I shared with the Selectmen today. Updating social media trends. They're doing this now 3 times a day. And they said the reason they're doing it is their concerns for inaccurate social media. They're telling people, refer residents if they've got questions to the state public health as a resource, instead of trying to answer things that maybe we're answering incorrectly. Safety and wellness to CDC and public health are encouraging us to use masks. Now they're saying lots of leadership will be wearing masks, help change maybe the culture in New Hampshire and reduce anxiety, and remind people about the social distancing, hand sanitizing, and we can't slip away from this. We need to maintain this. They're also working on a board. This really doesn't concern us necessarily, but the EOC, the state is using the board to replace the organizational chart that was previously used, and they're telling us where to go to look for this. They also said that the state is trying to reconfigure their building to provide more social distancing for their employees. They say there may be changes in where you are working. And again, this is in the state building where they're trying to keep everybody working but apply social distancing. They're trying to find a balance between working remotely and social distancing. They're getting a lot of praise for the way they're doing things from other state agencies and how we're staying up to date, how the locals are staying up to date with information as it comes out. They did say, reminding employees, if you don't feel good, don't come to work. And the state said they're planning a deep cleaning of the buildings periodically, and they're doing this just as a precaution. Okay, that was the first call. The second call is the Fire Marshal Parisi said if we have first responders that have been quarantined, they're asking to please make sure that the EOC is notified so we can list it on the EOC. And then when they come off quarantine, we're supposed to pull them off of that. They're trying to keep track of first responders because, number one, how were they exposed? What do we need to do to help first responders? And the only way they know is if it's put on that state site. But Chief Jewett realizes that, and obviously Chief Alcadino and the emergency management people. We have 119 first responders that are now quarantined, and they said that's down from yesterday. The list goes out daily, and if we've signed up for those MOUs, again, be patient. Sometimes the data is not accurate, as we heard on yesterday's legal call, but they're doing the best they can through that E911 process. But they also said if it continues to have breaches of confidentiality, they actually may stop doing the list. And that would be a shame to pull it back after police, fire, EMS, everybody has worked so hard, along with the public health, to actually create this database. They're talking about revising the unprotected exposure based on the latest CDC guidance, so we're going to be seeing that. And then Perry Plummer said they're putting together a survey of people that are on our calls that we do, and most of us, both chiefs, Larry, I'm sure Bob Leverone, are on these calls, and they want to know what we want for info. Are these calls working for us? Are we getting what we need to know? They also said if we don't have PPEs, call the EOC immediately. They said they will get it to us. We've got quarantine facilities, and we're setting up homeless facilities, and they've evaluated 100 sites and determined what makes sense. And if it turns out that there's going to be a site near us, and I don't mean us specifically Newton, but near your community, they will, while they're in the planning stages, they will reach out and let you know so that you're not the last to know, as they say. We did have 7 deaths yesterday, so now that's a total of 18. But they did some of the deaths, not that this makes it any better, but some of the deaths were in nursing homes, and they'll do a press conference tomorrow on that. They also said the courier service now is tapped up a bit, and now they're maybe going to be able to pick up the test for first responders. Surge sites, they're going to be making them 1 unit. So that doesn't necessarily apply to us, but in some towns, multiple towns pull together to deal with a large-scale emergency. So what they were talking about, okay, who pays for this if we've got, say, 3 towns that are involved in the surge site? So now they've come up with a plan to make a surge site 1 unit. And then we had questions. Questions regarding the MOU. This one police chief, I think it was a fire chief, said he was sharing his list with the police department, with the police chief, and also putting the list in the ambulance. And they reminded him that the ambulance service does not have access to this list, but police and fire can have the list. If an ambulance is going to an address that has tested positive, you obviously can use the code words to let the ambulance know, but they don't get the list. And this particular person was also sharing information with the selectmen, and they were reminded they are not allowed to have the list. And again, they talked about don't breach this because the departments really like this. It helps them. There was clarification on peak time, and Sununu gives that information, and it comes from a national level. Tomorrow, Dr. Chin will be giving out accurate info, so they urged us all to be on that call. Someone from a fire department asked about donation of cloth masks, and should they use them while they're on the scene. And the answer was it's important to know that the mask situation is to protect the environment from the person wearing the mask. It does not protect you from the environment. Cloth masks should be used only as a last resort. And they said don't use cloth masks on scene. They will not protect our first responders. There was also a question about the recovered rate. How is it measured? And the answer was public health tracks and then reports when the symptoms end and the 72 hours are clear without the use of a fever reducer. Health officer comment was workers are coming from out of state. They've got a lot of seasonal employees that are now arriving. They said somebody actually arrived from Texas, drove all the way from Texas, and the question was, should they have isolated?
Charlie.
And they want advice. They're looking at an executive order, and comments should come from public health. However, they did say if a person took public transit, then they should self-isolate. And anything more than that, if this person wanted more questions, they said they'll answer them offline. Someone from a police department said they've been working with adjoining town regarding parks that border two towns. They're having a problem with people on trails getting hurt and then having to respond. And they wanted to know if the state was going to provide additional services because now it's got increased activities in parks that some cases need to be rescued. And they said they're going to bring that to the governor. So we'll get more information on that. There was a comment from somebody that an outside Massachusetts hospital called and said that two individuals tested positive, and they've come into this particular area, not us, but this person that made this comment, and they're staying here while they're recovering. They wanted to know if information from another hospital, could they share that information between states? And the answer is there has been no discussion with sharing information between states currently, but a case-by-case basis maybe should be discussed. So if you got that call, if it was our particular town, maybe one of our chiefs got that call, then maybe we would discuss it with the state that called it in to see how to handle it on a case-by-case basis. And then there was a question from a police department regarding the appropriate level of PPEs and which ones work to keep first responders safe. And to protect your first responder, they should be wearing N95 masks. The surgical ones are not good. Cloth masks will not protect our first responders at all. And that was the 3 calls.
All right. Quite a lot. Any questions for Trish on what came up?
I have one question, Mr. Chair, for anyone.
Go, Chief.
I know Trish brought up the campgrounds. Do we know if the campgrounds are open in Newton? One of them is one of our favorite places because we get a lot of business from.
So they are seasonal. Has anybody heard anything from them?
They normally open up on Memorial Day, I believe.
Yeah. So I guess we have to make a note that as we get closer to Memorial Day, if we're still on lockdown, we need to kind of have somebody have a chat with each of the owners.
Matt, this is Tricia.
Yep.
The only other thing about one of them, their staff that comes in to get everything ready starts usually on April 15th.
Okay.
Okay.
So that's coming up. So do we know how to get in touch with them at this point?
I probably have contact information, but I'm sure probably Nancy does too.
Yeah, there's probably something on the building permits and the files. I could check that on Friday when I go in to check the mail.
So I guess my question is to the EMD and is who makes the most sense to kind of reach out and kind of have a chat with them, see what their plans are, what makes sense.
Matt, I can take care of that.
Larry, cool. So that'd be great. So Larry and Nancy and Trish, you can round up the numbers and just see what the plan is for them.
Okay.
I know, Matt, what I was going to just say quick, I know the warden usually goes out there before they open, because by statute, he's going to inspect the place and give them permission to have the open burns.
Okay.
So I'm not sure if somebody wants to reach out to him and just advise, let him, I'm sure he's aware of everything, but somebody might just want to touch base with him and just make sure that obviously if they can't open, everybody's on the same page.
Okay. All right. So, Larry, is the warden somebody you would want to talk to, or should the fire chief do it, Larry? What do you think?
No, I'll get a hold of Billy. No problem.
Thank you.
You're welcome.
Okay, so anybody else under Trish's department there? Any concerns around what she just shared? The hopeful thing I find, and you have to have hope in these situations, is, the numbers in the models don't appear to be coming to fruition right now. So every day changes. We know that's the theme of this whole thing. But as we see it right now, I heard the governor today at 3:00 say that they thought the peak would be at the end of April. Now they're thinking the peak might be next week. And, next week we might have found out we already hit the peak. So fingers crossed, I guess.
Right.
One thing I wanted to bring up, and this is a little background for the public, is there's a couple of different subjects. In the first subject, this is clarity I got from the tax collector, but tax deeding, I want to put that aside for a minute. Tax deeding, we don't need to really talk about tonight. Tax deeding is seasonally, it's a little later than now, and we'll see what happens. I want to talk about tax leaning. And the board in non-public talked about tax leaning last night the reason we did it in non-public was out of concerns that we would have to name names. Now, sharing with the board, they got an email from the tax collector today. I got on a phone call with the tax collector. And when it comes to tax leaning, we should be understanding that these are people, and it's around 55 people, who owe some portion of their taxes from last year. So they have been given notice, progressive notice, through the tax leaning process. Matter of fact, some of them have already made arrangements to pay. And what we talked about last night was using our power, as the governor has kind of talked about, using our power to see if we wanted to extend that. So I think we had talked about doing one thing last night without the clarity from the tax collector. So I'd like to propose to the board that we reconsider, and here's why. The tax leaning, as people have now been noticed to, is that they have a due date sometime in May. It's really not important for our discussion, but they've been given certified letters to say you owe by this date in May. For us to retract that would mean more certified letters, approximately $400 in postage, to let people know that now they're getting a new date. Okay, let's say that date's September. So here's the thing. The tax collector fully expects, since this is money that people owed from last year, that most of those people will pay on time. Well, not on time, but on time for the date that was noticed. And there'll probably be 4 or 5 people that typically do not, and we can cross that bridge when we come to it. So I'd like to ask the board what they think about kind of making a new motion tonight and sticking to the original date. What does the board think?
I can make it easy. I can move to rescind the motion from last night regarding leaning.
Do you want to, just for the public's benefit, do you want to explain what your motion was last night?
Yes. So I am moving to rescind the motion to extend the leaning process to September or the end of the pandemic, whichever comes first.
Okay. So that's a retraction. Is there a second for her retraction? Do we do seconds on retractions? I don't think we do.
We do.
Right?
Yes.
We do. Okay. Who's going to second for me?
I'll do it. Second.
Charlie's a second.
And Charlie, that's because we want to make sure the majority of the board agrees that it should be rescinded.
Yeah, that makes sense. Okay, so we'll go around, roll call vote. Charlie?
Yes.
Lisa?
Yes.
Larry?
Yeah.
And is Kate on?
Yes.
Okay, great. And I'm a yes. So that's all 5 members. So it's if you could kind of report to the tax collector, Diane, what we did tonight. And she's just, bottom line is it's status quo, continue with her plan as planned. And then we'll come and talk to her, or she'll come and talk to us if and when there's a few people who have not paid by the date.
Yep, I can do that.
So that's per norm. So not Norm from Cheers, per normal. But, the comedy is free, by the way. So anything else on the agenda, anything that anybody wants to talk about tonight?
Matt, I have one thing.
Nancy?
Could I ask Tricia? She mentioned something about the conference call tomorrow. Is that the legal one, Lisa? Tricia, at noontime?
Yes, it is.
Okay, thank you.
You're welcome.
All right, so if there's nothing else, I'm going to ask for a motion to adjourn.
Actually, it's Kate. I have a quick thing. Can you hear me?
I can. Kate, go ahead.
Okay, so is Mary Jo's not on this call right now?
I do not believe so.
Okay, just the issue. I know we discussed everyone about the sprinklers and Diane letting someone in for a estimate, and it was pointed out that when that occurs, you have a new person entering the building, and people there felt the building should be cleaned as new people come in, and was very concerned about that. So what do you guys think?
I can tell you I spoke to Mary Jo today about it, and I told her that we discussed all options, and that's kind of what we agreed would be the least amount of exposure would be when the least amount of people would be in the building. So all I can do right now is share that info. She seemed to be okay with that.
Okay.
Okay. Did you have something else, Kate?
Nope.
Okay, awesome. Anybody get a motion to adjourn?
So moved.
All right, second?
I second.
All right, well, roll call. Charlie?
Yep.
Lisa?
Yes.
Larry?
Yes.
Kate?
Yes.
And Matt's a yes. So have a good evening, everybody. Thank you for your time, and we'll be talking soon.
Good night.
Good night.